Hello and happy holidays to you. This was a special quick segment edition because I recognize that with all the questions I'm getting about a few of my other lives as it relates to holidays and gathering, I just found it important for us to get together now and just talk about where we are in terms of gathering for the holidays. Let's be clear. The CDC says no gathering. The CDC does not recommend gathering. The World Health Organization does not recommend gathering. And most states do not recommend gathering for the holidays. And let's be clear as well. As a public health official, that is my recommendation as well. However, as a person who is seeing COVID patients in the ER and talking to them, and also by the data that comes out from our previous holidays, it is believed that over 70 to 80% of people are still going to gather. They're still going to gather for the holidays. Let me just say this as one nugget. If your holiday gathering and season is the same as it's always been, you're likely in for a whole lot of pain. If it is the same as how it's always been, you're likely in for a lot of pain, as evidenced by what went on during Thanksgiving, and we're now feeling the effects of that. But this is not a lecture. I just want to be clear about how do you get that if you're going to gather. What's the safest way to do it? One more time. And I was like, why is he saying this again? It's my recommendation for you not to gather, and that's what most governments say. But given that people have shown that they're going to gather, we've got to do it as safely as possible. Let's get to the heart of the matter. Today is the very absolute day that if you're going to gather, you can gather as safely as possible. Today's the absolute day. That's the absolute. Technically, you may be about 24 hours late, but it's better to do it this way than nothing at all. If you're going to gather, Christmas is about 7 days from now. You have to isolate starting right now. Isolate, quarantine starting right now. Whoever your guests are coming from out of town, they've got to isolate and quarantine right now. Yes, that may mean no shopping. Yes. They've got to isolate and quarantine right now. Here's why. Just based upon the timeline of the virus, we barely have enough time to catch it. Say you got infected yesterday. You're going to start to isolate now. You may be one of those who you don't have any symptoms. You'll take your test, your COVID test, probably about Tuesday or Wednesday. Make sure you take it from a place that's going to have it back before Christmas. So you're going to take your COVID test about Tuesday or Wednesday, and you're going to quarantine and isolate once you take that test. And then when you get the results back and they are negative, then you can be good to go. I'm sorry, I should wrap this into a bigger picture. If you're going to gather, there should be a family meeting. The family meeting should be, what is the ticket price? What is the ticket cost to get into the family gathering? And let me tell you what I mean by a ticket cost. One of them that I highly recommend, a must be, everyone gets COVID tested. Everyone gets COVID tested prior to the gathering. Everyone has their temperature taken. Once they get to the gathering, before they come in the house, they have their temperature taken. Follow me here. This is where leadership from the family happens. The leadership starts right now. Later, call the family meeting, lay down the rules, and this is when it gets interesting. It would be interesting in my house too. So the rules are: you have to have the COVID test, and it has to be negative. And if you get to the front door and we take your temperature and you have a fever, you go home. Those have got to be the rules. Now, look, you cannot put the 12-year-old boy in charge of taking people's temperature because he'll get pumped. Look, it's got to be the heavy of the house. It's got to be the heavy of the house who everyone knows the rules. So some people should be sending out their emails now. The rule is, if you come to the front door, you got to have your COVID tested. You got to have your COVID test. And there's some nuances to that. But if you come to the front door when it's time to gather and we take your temperature and it's above whatever you all agree, you can't come in. Woo! It gets difficult because if Aunt Betsy, Aunt Sally, or Uncle Hakeem, if they drove an hour from across town, telling them no, the heavy has to be at the front door to gather that. Trust me. I know I sound like I'm talking, but the heavy has to be at the front door to do that. Now, just as a nuance, this is not scientific based, but I heard Dr. Fauci talking about it, so I haven't read an article. If you all live in the same household, and say there's 5 of you, you all have lived in the same household, it's 5 of you, and 2 or 3 of you go get tested, and those are negative, it's a reasonable leap to assume that the other people are negative. It's a reasonable leap. Ideally, you want to get everybody tested. But again, if it's a bunch of you all who live in the same household, you've been interacting, and you've been isolating, it's not unreasonable to only get a couple people, get a sample size of that family, get a couple people to go get tested. If their test is negative, then you can assume the rest of the family is negative. That's only for people who live in the same household. Let's go back to the rules. A, the family meeting. B, tonight. B, isolate tonight. C, B. Family rules. One of them is everyone must get a COVID test because it's so available, and people must have their temperature taken and a plan of action if it is high. All right. Rule number 3. No out of town guests. If you're coming from out of town, no out of town guests. When I did this a few weeks ago, everyone sent me all these emails about why. Because it gets difficult trying to figure out, are you coming from a highly infectious area to a less infectious area or vice versa? So it's just better to say no out of town guests. The last thing you want is someone coming to town who's coming from an area that's highly infectious, and they're coming to your house where you don't have that much infectivity. And plus, that's the CDC guidelines as well. They don't recommend it, but they definitely don't recommend traveling. Then arrival check. During the event, everyone must wear the mask unless they're eating. During the event, everyone must wear the mask unless they're eating. Ideally, if you can have this event outside, great. Follow the CDC guidelines during the event. Follow the CDC guidelines during the event. Shorten the duration of the event. Shorten the duration of the event. Let's go back to my original part about leadership, because we did this during Thanksgiving. You cannot imagine the number of emails and texts I've got. The leader, the one who's got the horsepower to enforce, the one who's got the horsepower that the family will listen to, that has to be the person who says these are the rules and enforces those rules. And the reason why I did this live right now is because today's the absolute last day, according to how the virus rolls or replicates, how it replicates. This is the absolute last day. And it actually should have been yesterday, but I would much rather, if you're going to get together anyways, I would much rather you jump on this now at the last minute. And look, this includes, I know it's hard, and coaches are out there and people with these recitals. It means that your players can't come to practice, and they're going to be all right. It means that your players cannot come to practice. And I get it, for some of these high school teams, they're doing tryouts and all that. Frankly, I had the same issue in my house because both my kids play sports, and we had to shut it down. Why? Because we're quarantining as a family, and because we're all going to we've all quarantined. We're going to get tested because we all have to be around. We're all going to be around my mom, who lives 2 miles away, and so this is how we're doing it as a family. I say coaches, people who are in charge of large gatherings, or of not of large gatherings, of people getting together for whatever event. Give your participants a break, please, because now they're trying to protect their families. And for students, for athletes, it puts them in a difficult spot when the coach wants you to do one thing, and your parents want you to do something else. And I know people say, well, the child should listen to the parent. Yes, because the parents exert leadership. But why put all that stress on the child? And I think that is it. So again, this is about exercising leadership, and this is about the decisions you make. There are two different decisions that we're going to make over the holidays in very broad categories. Deliberate decisions where we have time to think about it, plenty of information, and you can figure it out. And then there are split second decisions where you may not have enough time, you may not have enough information, but there will be severe consequences. Look, heavy at that front door, the decisions you make will be consequential, especially if they have a fever. And if you wonder why I keep harping on that, the examples I received during the holidays, that's why I was able to nuance it. Hey, don't put a teenager out there. Don't put a 12-year-old out there. Put the heavy of the household. All right, everybody. That's it. Thank you for listening. Let's just take a couple questions here. Hello, Pirate. What's up? Sandra, what's going on? Cruz, what's going on? Portia Snelly, for people who are immunocompromised or want to wait while to take the vaccine, will they have to isolate and wear a mask indefinitely? For people who are immunocompromised or want to wait a while to take the vaccine, will they have to isolate and wear a mask indefinitely? Not sure about understanding your like question, but if you're immunocompromised, you've got to talk to your doctor anyways, even as it relates to the vaccine. But if you're immunocompromised, you should be wearing your mask. If you're immunocompromised and you take the vaccine, you should be wearing the mask. And here's why. Because the vaccine, it was not studied that once you get the vaccine, are you not able to transmit it to other people? All right, are you not able to transmit it to other people? And then, so that's why no matter what, you should be wearing your mask. Here we go. Vincent says, I don't mind being the heavy. So Vincent said, I don't mind being the heavy. What that says to me is that you are a leader within your household, and that you're grown. You know, because a 17-year-old, my daughter, bless her heart, she's a strong lady. She's like her daddy. She's strong. She would say, I don't mind being the heavy, but she doesn't understand what comes with that. Because when another heavy comes to the door, how's that play out? So Vincent, I'm proud of you, brother. Excellent leadership. Nikki, great news. Thanks, Geoffrey. Hey, good. No problem. Good. Edward, hold on. Here we go. I skipped a couple people. Portia, I heard on the news for the U.S. to achieve herd immunity, at least 100 million people need to be vaccinated. It's just a fact. I would say, I'm not sure where you got that figure, but it's going to need to be over 100 million people. It's going to need to be over 100 million people. But let's just look at it this way. We can back into it. There are 350 million people in this country. You need about 75% for herd immunity. 100 million people get you a little above a third. The question is how many people are already infected? Because then you include that. So 100 million sounds a little low, but nothing. That wasn't me. That was you. That was me using my math major skills. So I don't have an answer for you for that. But very good question. Hey, good morning, Michael Edwards. What's happening? Craig Coleman. What's going on? Nikki, great news. Yeah. What's up, Fred? Oh, by the way, nothing I say should be taken as medical advice. This is for information purposes only. Nothing I say should be taken. Thank you, Fred. What's the most reliable temperature device? I don't know what's the most reliable temperature device. It's funny. I just wrapped a gift and I bought one. Did some small research by it. I bought it months ago. The question, Vincent, that you probably want to ask me, what temperature would I recommend? You know, because if you read 100 different articles, that's right. If you read 10 different articles, they'll give you 10 different temperatures. Some will say 100.5, 100.8. If you want to be just clear, there's a clear 100.9. There's no nuance. It's 101 definitely. 101 definitely. You know, but 100.4 is reasonable too. So it's going to be the temperature. That's absolutely key. So is there any new data or insights on transmission in schools? And hey, Shante, what? There's a lot of data, but it's mixed. And I don't rant. I'm not going to, but I will share an opinion. I'm a little frustrated with these school systems and these needing to get these kids back in sports. But I get it for the varsity sports. And here's what I mean. Because all over the country, there are varsity games still going on. They are still playing. And for the seniors who are competing for the scholarships, I get that. But freshmen, sophomores, juniors, I'm just not feeling that. And in my area, many of the local schools have shut it down, but there's some private schools which are right next door to some public schools who are still playing. The data as it relates to children, they can pass the virus on to others, but they're not getting as sick. My pause is there's several articles and they just tell you two different things. I'm going to do a full live about going back to a school coming up as I did back in the fall. Just give me a moment to gather and synthesize all the information. But great question. Should people be scaling back on casual contact on day-to-day activities? Oh, absolutely. Cruz of Inc. Radio 102.8 writes, should people be scaling back on casual contact on day-to-day activities? If you're talking about as it relates to the holidays, absolutely. Absolutely. Scale back 100%. But overall, there should be no daily contact with anyone outside your home. No. At the very most, and I don't recommend, in fact, the CDC has even talked about it, the little fist bump. No. You can do a fake one, everybody fist bump, but don't touch. Let's be clear. Things are the worst that they have ever been. They have not gotten any better. The vaccine is here, yes. But keep in mind, we won't see the benefits of that until June. By April 1st, the vaccine would have saved 9,000 lives. That's what the models show. By April 1st, a mask would have saved at least 70,000 miles. And let me just tell you about why it's so important to wear a mask in the house. I know you've heard this, but let's just explain it this way. COVID virus is not a one-to-one transmission. A lot of it, so it's not guaranteed that if I have COVID and you're sitting next to me, it's not guaranteed that you're going to get it. But a way to make it less likely is a mask. Here's why. Studies show that in order for a normal person to be infected with that COVID, they need to be exposed to about 10 to 1,000 particles of active virus. 10 to 1,000 particles of active virus. Everybody put a 10 in there. 10 to 1,000 particles of active virus. That's all you need to be exposed to. And needs to go in your oral airway, and it even gets into our eyes. An actively infected person, someone who has got COVID, every time they breathe, they are breathing out between 10,000 and 10 million units of active particle. So for those of you who are gathering, if somebody sneaks by and they have COVID, that's 10 million units being breathed out constantly. The way you minimize your risk are mask. The way you minimize your risk are rest. Why? Because if you have on a mask, it minimizes your exposure. If the active person has on a mask, most of the virus falls to the ground. That's why it's so important to ventilate. Ventilation, it like spreads the virus out and forces it to the ground. Most viruses fall to the ground. I hope this was helpful, but I hope that answered the question. That's why masks are very important. Let's just take it a step further, since you all are an educated audience. The quality of your mask matters as well. If you got some cheap, flimsy mask, no mask is better than nothing. But if you got some cheap, flimsy mask, you know, the filters in there are real large, which means that the virus, it's easier for the virus to go through it or around it. This is one of those times where quality matters. Hey, that's it. Let's go. I'm going to answer a few questions. I have at 11 o'clock. Hey, newbie, what's going on? Doc, great advice usually. Thank you for keeping us little people. I'm glad you and your family. Hey, Frazier, what's going on with you? Should I consider getting a vaccine even with having 2 pre-existing conditions? I would say talk to your primary care doctor. There were people who were included in the study who had pre-existing conditions. By the way, do what you want. I'm not trying to sell anything to anybody. I've recommended to my family and friends to get the vaccine. I'm getting mine today at 2 o'clock. I am so excited. They canceled me yesterday. There's no doctor, no black doctor, no white doctor, nobody I know who's in the healthcare world who's not getting the vaccine. Again, for your no-vaxxers, I'm not trying to recommend anything to you. All that I'm recommending is that we at least push to make sure that the vaccine is available to our community so that people can make whatever type of educated decision that they're going to make. But I highly recommend it. Nothing I say should be taken as medical advice, as information purposes only. But I would highly consider it and make sure you make your decisions based upon true information, and be willing, because most of us won't have access to the vaccine for a few months. So for those of you who are fixated on not getting, all that I ask you to do is open your mind up to decisions. Be willing to decide, be willing to make new decisions as the information becomes available, as new information, new, true, and objective information. By the way, I've attached a bit.ly to this. You can see it in the headings where you can, all the information just in terms about how to gather, as well as the vitamins. And let me just deal with this vitamins just real quick, because I did a show yesterday and one of the guests said, yeah, it's true that it is important that we keep taking our vitamins. I'm not just saying just keep taking your vitamins. That's not what this is about. Prior to COVID, I didn't mention vitamins. I'm specifically mentioning 5 important vitamins, but if there's one I had to hang my hat on, it's a vitamin D. So don't act like I'm just saying vitamins. No, vitamin D for a reason. Again, the studies are getting even more clear. If you want to get COVID and decrease your chances of surviving COVID, have a low vitamin D level. That's how you would decrease the chances of surviving COVID. Everyone, I've got to go. Sorry to rush, but don't forget, if you're going to gather, this is the safest way to gather. Be safe, and I'll talk to you soon. Bye.